Now, let's transition to technology focus section from the executive technical presentation. There will be some overlap between the technology and why EDAP. Those slides that can be in either camp will be combined. Feel free to use the slides labeled technology/why EDAP for either section during the role-play evaluation. The key message for this slide is that the Focal One platform was designed for urologists to precisely ablate prostate tissue. Dr. Urologist. This machine was custom designed to meet your needs. Some ideas to include in your talk track include: Focal One was built to ablate prostate tissue, period. This tool is designed for you. The robotic positioning system allows seamless movement, while constantly monitoring temperature, amp, rectal wall location. The best-in-class fusion software is fast, easy to use and provides a detailed map of the prostate. Integrated workstation, mobile amp-compatible standard beds. The dynamic focusing probe allows for real-time imaging, while precisely and accurately delivering energy to the targeted area. Remember, Focal One has 4 different safety measures built into the system: the patient movement detector, the constant monitoring of the rectal wall and temperature, and it is completely controlled by the urologist. Emphasize the different safety mechanisms and why it's important to them and their families. Some probing questions to ask when using this slide: what has been your experience using HIFU for intermediate risk prostate cancers? Do you perform fusions? What platform do you use? If you could design a HIFU platform, what would it look like? What are some challenges associated with legacy HIFU and fusion platforms? In your mind, what is the average time for a HIFU hemi-ablation? This slide is challenging. Anytime a video is playing in the middle of the presentation, it can be uncomfortable for everyone. Use this slide as an opportunity to dig deeper and learn more about what's important to your customer. Watch their reaction, eyes, body language as they watch the video. Fill space with meaningful questions related to the video. Cement it. Be very direct and simple when introducing this slide. The key message should be the opening sentence. This short video will introduce you to the Focal One platform, its components, workflow, demonstrate its ease of use and precise contouring of ROI. As the video plays, highlight key features and correlate it to the clinical application, their priorities and unmet needs. Make sure to include the value propositions associated with RFI. Remember to use this as an opportunity to ask questions in context of what the customer is watching. Some probing questions to use for this slide: do you perform fusion? Why do you not perform fusion? What platforms do you use? What changes would you like to see? What's missing? This is a slide you can use to really differentiate yourself from the other focal options in the market. This is how we explain the secret sauce and how we are able to deliver energy that can effectively reach lesions up to 40 mm anterior to posterior. You and I know the limitations of focal therapy, specifically HIFU. HIFU is quickly ruled out as an option for large glands or anterior disease. Focal One's dynamic focusing probe delivers energy from 8 focal points in increments of 5 mm. This lets you ablate tissue quickly and from multiple different angles. Staggered focal points on the transducer allows the stacking of energy when applying HIFU to a lesion. Some probing questions to ask when using this slide during a sales call include: why is patient selection so important for HIFU procedures? What are technically challenges associated with HIFU technology? What are some of HIFU's limiting factors? This slide also shows the value that our technology brings to the hospital. Focal One is fast, efficient, and easy to use. System ablates 30 cc per hour, reducing typical hemi-ablation case times to under an hour. Think about the following as you build your own talk tracks for this slide. Focal One technology expands access to focal therapy for patients with anterior lesions up to 40 mm and large glands. Focal One is faster than other HIFU platforms, ablating 30 cc tissue per hour, compared with 10 cc tissue per hour. On other platforms, delivering energy in 5 mm increments allows easier lesion countering. Avoiding critical structures translates to 45 minutes for a focal treatment and hemi in under 60 and whole gland in 90 minutes. Use the following probing questions to engage your customer. What type of focal do you offer patients with anterior lesions? How long are your focal or hemi ablation cases? Do you have patients that would be ideal candidates for focal therapy, who end up with relapse because of tumor location or gland size? This slide tells the customer who we are, what we do, how we do it, and why we do it. You could spend hours discussing this slide with a customer. It lays out a value proposition clearly and succinctly. This slide should be included in any presentation or sales call using this slide deck. The key message for this slide is Focal One is committed to partnering with institutions to build robotic HIFU programs through trusted partnership and delivering on our core values. Here are some examples of bullet points to use while telling the slide's story. Focal One partners with HCPs to build sustainable, clinically effective AMP, economically successful programs. Mobile service providers are transactional. Focal One clinically supports the technology, but offers a programmatic approach to HIFU therapy. Best-in-class technology, providing an end-to-end training program. AMP supports the customer's strategic priorities with a customized marketing program. We are proud of the level of clinical support our team provides hospitals, physicians, and patients. It's unparalleled in this space. This is a great slide to understand how the customer likes to collaborate with industry, and besides our technology, our major differentiator is our people and what we offer the customer every day. Some questions to ask a surgeon when presenting this slide. What's your relationship like with mobile provider? What's most important to you when evaluating new tech? What is the current strategy to grow the PCA program? How have you managed robotic services lines at this hospital in the past? Do you have a centralized committee? How do you quantify success? How/why did you launch the robotic program? What are the one of two most important initiatives for the practice or hospital in the next 24 months?